Welcome to Baba's Talk Show, recorded live in Gold Coast, Australia.
Welcome to another episode of Baba's Talk Show. I'm Hussein Baba. As usual, I have special guests appearing in our show. Now, today is not exceptional, but today is not like my usual format where I invite community leaders, but today is a professional in mental health. Okay, so I'd like to introduce to you Millie. How are you, Millie?
Hello, Hussein. How are you?
Good. Nice to see you.
Nice to see you too.
Yeah, good.
And thank you for having me on your
Of
talk show.
course. We need to have you. It's been a while now. I've been asking you, but now you're free, so you're able to come today.
Yes.
So Millie is actually the Multicultural Mental Health Coordinator. She works with the Queensland Health. Is that correct?
Yes, that's
Right.
correct.
Okay. Now, naturally, my question will be, what does a Multicultural Mental Health Coordinator do?
Okay, so my role as a multicultural mental health coordinator is in 3 parts.
Right?
So the first part involves clinical work.
Okay.
So that's when I provide cultural consultation
Right.
to the treating teams within our mental health services,
Right.
both inpatient
Right.
and in the community. So
Yeah.
when they are working with people from culturally and linguistically diverse backgrounds,
Right.
and the treating team is facing barriers with
Right.
engagement or
Right.
with treatment, it may be due to cultural or religious reasons.
Right.
And they need some assistance, also some consultation on how
Right.
best they can work with the people from a culturally sensitive and culturally responsive way.
Right.
Then I come in to support both the treating team
Right.
and the consumers and their families as well,
Oh.
so that they get culturally responsive treatment. So sometimes it may also be when treating teams are not so sure whether
Right.
which part of their presentation or which
Right.
part of the consumer's presentation is cultural
Right.
and which part is mental health,
Right.
because sometimes in some cases there may be some confusions, because in some cultures, talking to spirits
Yes.
can be culturally normative.
Right.
Whereas in our mental health
Yeah.
medical model, it
Yeah.
can be regarded as an illness.
Right.
So trying to differentiate between that,
Right.
so that people are really diagnosed correctly as
Okay.
well.
Okay.
So I provide, those consultations. It can be sociocultural assessments,
Right.
and to try to figure out from the people that
Yes.
we're working with what they think is going on for them.
Okay.
And so that we can also incorporate
Right.
their cultural considerations into
Uh-huh.
their treatment plan as well, so
Okay.
that they get a holistic
Okay.
treatment.
Good.
Yes, yeah.
So
And-
please go on.
Sorry, and so that's the first part of my role, the
Right.
clinical.
Yes.
And then I also do service development, which is training and education of our staff as
Right.
well,
Right.
so that we are a culturally competent and culturally responsive service.
Right.
And then the third part is community partnerships,
Right.
like what we are doing here. So
Yeah.
I go out there in the community, get to partner with community organizations,
Right.
community elders like you,
Right.
and collaborating also on what the community wants or the organization feel that they need help with in terms
Right.
of like mental health. So
Right.
sometimes it can involve collaborating with organizations to provide training
Right.
to their communities or to their organizations.
Right.
So the training that's like culture and mental health training,
Right.
or it can be like what we are doing right now, collaborating and providing information around mental health, so that we help destigmatize mental
Okay.
health in the community as well.
Millie,
Mm.
this is the longest introduction that I've heard so far in my show.
Yes.
The amount of work that you're involved. I'm going to keep you busy all the time.
Oh, I'm always on the road. I'm always busy.
Busy. And also, as part of your job,
Mm.
you get to know many different cultures as well, right?
Definitely,
Meet people.
yes.
That's good. That's advantage, which I like.
Yeah,
And,
it's always a learning experience.
Of course, a learning experience. I
Mm.
still learn.
Mm.
We all learn. So mainly, back to the point of mental health.
Mm.
When do you confirm this person has a mental health issue? At what stage? You go through an assessment, right? You go through an assessment,
Yes.
and then at what level that you have a mental issue?
Okay, so when it comes to, maybe I can start by saying, the development of mental illness it can be gradual, it can also be sudden. So when, for example, there are so many symptoms that can lead to mental illness.
Right.
So, for example, when people start having unusual or illogical thoughts.
Illogical thoughts, okay.
Yes, and when people start having like unreasonable anger or irritability.
Okay.
And sometimes extreme dieting. So when people sometimes go to the extremes of dieting, it can be called,
Okay.
eating disorders.
Right.
And some people can also experience, deep stress, sadness, intense sadness, or some fears and anxieties. But it has to be ongoing for 2 weeks or more.
Okay.
So if you start noticing that, the person is behaving unusually from their norm,
yes,
like maybe they used to be a happy, outgoing person, and they start isolating themselves. They are not able to cope with everyday life, like they're not able to work anymore or to do the things that they used to do. They don't find enjoyment in what they used to do anymore. And sometimes when people start believing that they have like those grandiose ideas, or they start seeing things or hearing things that other people are not seeing, and if it's ongoing for 2 weeks or more, that's when it needs attention, and that's when people need to go get an assessment. It can be through their GP, and if it becomes worse, it can be through the hospital, through the mental health services. So when people start noticing that, then it may need further assessment to be treated.
So usually people who might notice this are the immediate family members or some close friends, work colleagues, like out of the norm, right? Anything like they're getting angry suddenly, sad, and this has to go through a period of two weeks. And then that's where the concern comes.
That's
right?
where the concern comes.
So what's the next thing? They should contact the GP.
Yes, they should contact the GP. But what I also usually recommend is, it can be ongoing for 2 weeks. But if you feel that because I always believe that early intervention and prevention is key before it gets to that crisis stage.
Right.
So if you see your loved ones or someone you work with, or even yourself noticing that something is not right with me, I would recommend and I would advise people to go and see their GP as early as possible. So that interventions are put in place before it gets into a crisis. For example, another thing that I forgot, poor sleep.
Poor sleep,
can also. So there are also other physical factors that can also influence extreme tiredness, poor sleep, lack of concentration, all those things. And if it's out of the norm and if it's ongoing, then that should be a cause for concern and seek medical help.
So Millie, in the mental health issue, do they have different stage? Like stage 1 or stage 2 or stage 3, the seriousness is go higher, just mild cases at the bottom. Do you have different level categories?
Oh yes, you do have mild cases, moderate and severe cases. And I guess with especially in this role that I'm working in, we tend to see in our service that most people from culturally and linguistically diverse backgrounds access mental health services when they're already in a crisis.
I see.
When they're already at those severe cases. And there are so many factors that can affect. It can also be our conceptualization of mental health. Because, and I did mention that in most culturally and linguistically diverse backgrounds, mental health is very stigmatized. For example, where I come from, some symptoms of mental health may be regarded as spiritual attacks or madness, or people will start labeling you as crazy.
Yes.
So because of that word as well, it doesn't also exist in most cultures because it's a Western word.
Yes.
And when people hear that, they don't want to be associated with it because they're afraid that they'll be alienated from their community, friends, or relatives. So sometimes people keep it to themselves when they see, those symptoms of mental illness,
right,
because of that stigma. And the reason, and we try to solve it within ourselves. And then by the time when family members or community members get to the stage that they can't handle it and it has become worse, that's when people access services, when they're already in a crisis, and when they're already maybe in a severe state of mental illness. So I guess we have so many other factors as people from cult backgrounds that affect us. It can be also our migration journey that can also impact.
Yes, of course.
And it can also be there's what we call the healthy migrant effect, which says that usually when people migrate into a new country,
right,
they come healthy, but within 6 months to a year of settling into that country, they start developing physical and mental health issues. It can be due to settling stressors, which we call acculturation stressors.
Right.
It may be the change in food. It can also be difficulties finding employment, separation from family,
right,
and trying language barriers
of
as well,
of course,
and also trying to with culture shock as well.
Sure.
All those things can also lead to stresses and mental health issues as well. And also looking at people coming from refugee backgrounds, they're already traumatized when they come here, and trying to settle into a new culture as well, it re-traumatizes them. So all those other factors as well.
But it's good that Queensland Health have people like you can go and meet such people who are in need. Now, is depression part of the mental health?
Yes, depression is part of the mental health as well. And depression, that's where you start experiencing low mood. You start not doing the things that you used to enjoy,
right,
and start isolating yourself,
right,
not having any capacity to work or to exercise, all those things.
Right.
So those are symptoms of depression.
Okay. Well, I think it's not a simple thing. I mean, it's a vast area that which constitute mental health. I know there are other private organizations who are also trying to work with you guys. Is that good? Now, when you talk about mental health, we are talking about young and the youth and adults. It's not only restricted to adults, right?
No, it's not only restricted to
adults, right? So it's over the board. Okay.
Yes.
So now, from the GP refer to whom? To some specialist?
Yes. So it depends as you were saying, it depends with the severity of the symptoms of mental illness. So mild to moderate, the GP can refer to a psychologist, to counseling, so that people can get that talk therapy to talk over their problems. Usually it helps, and if it's severe, maybe the GP may not be able to handle it within the community, so they may refer to the public health sector, which is Queensland Health, and may refer for further assessment. And sometimes people may require admission if it has gotten to that severe stage. But if it's mild to moderate, GPs can refer to psychologists. We also have organizations like Wesley Mission as well, that do have some mental health programs as well, that they can work with people from in that mild to moderate position as well.
So I'm just trying to look at the journey. Let's say some family members as identify one of their member is having this issue, but you explain, they refer to the GP, and GP say, well, he should be referred, or he or she to be referred to a psychologist. So psychologists, well, now this process from psychologists, is there any fees involved?
Yes, it depends with the psychologist, but now because most people don't want to do bulk billing anymore,
Okay.
So I think the best option is to get a mental health care plan from your GP. With the mental health care plan, it you may get some money back from Medicare. That is if you have Medicare. And looking at people from culturally and linguistically diverse backgrounds, not everyone has access to Medicare, maybe due to the types of visas that they have.
Right.
So so there may be, so if you don't have Medicare, you may be required to pay the full fee to see a psychologist. However, I think Wesley Mission and I think PCCS, they do have like special programs for people who are on a visa and who don't have Medicare, and they can provide some free sessions. I don't know, maybe 6 to 8 sessions of psychology that could also be helpful to people who won't have that as well.
Because why I ask this question, because you are dealing with multicultural people.
Yes.
And of course, some of the multicultural are already Australian citizen, but there are people who came through the refugee system, or some people just came for a temporary visa. So in case of need, where do they go to? So that's it's very important that you mentioned they can go to, or they can get a plan if they're eligible. If not, they go to places like Wesley,
Mission,
and then they can have a chat with them, see how can they help. And I know you work for the Queensland Health, which is the government body. In your opinion, do you feel sufficient support is given to the people? I mean, when I say sufficient support, it's education to the multicultural community, especially those who do not speak English fluently. Have messages been sent out in their respective languages? I know, like Asia have so many languages. Africa have tons of languages.
Definitely,
Okay, talk about India, but fortunately India they speak some English, but many Asian countries they don't. So do you think the government have sufficiently provided information, or there's need to have?
I think there's room for improvement. As well. And I think in terms of, you mentioned a very good point when are people being given sufficient information in their languages as well. I think there's room for improvement for things like discharge summaries to be translated into the person's language, because sometimes when a patient is discharged from hospital and they don't speak English, the discharge letter is in English, and which has, the instructions of maybe it can be medication taking and all that stuff. And if you're someone who doesn't speak English at all, that discharge letter is going to be useless unless if you have a family member or a community or a GP who is able to translate that for you. So I guess there's always room for improvement.
Of course,
exactly, and especially in the multicultural sector as well. And also that's where my role comes in. But with my role, looking at my role being the multicultural coordinator for mental health coordinator for the whole of Gold Coast as well. My role also entails, providing that awareness and education. So it involves really collaborating with the community members, community elders, community organizations, and to direct me to say, okay, this is the need, this is what we're seeing. Can we collaborate on providing that education to the community as well? And there's certainly room for that with the use of my role as well.
Good. That's good. That's very important role. And I know they need people like you who are cool and patient, because this really needs a lot of patience. Dealing with different people when you don't speak their language, and you have to facilitate somebody to speak their language and all these things. Well, I can see that now that we had a better understanding of what a mental health issue is. I know it's a very generic term, everybody uses it, but they don't know particularly what is referred to.
Yes.
So it's good that you explained to us this morning. And Minnie, I really like to speak longer with you, but we always have a limit time.
Oh,
And of course, your service are really appreciated. That's what you're doing is a wonderful job. And I hope have less cases, you know. I know, like, especially people who are migrant, recent migrant, like you have a term for it, right? They come here, they have another issue, trauma. Is that
yes,
trauma?
trauma, yeah.
Yeah, trauma. There are, and then people have applied for visa, waiting for that. That's another trauma.
It's another
So
trauma.
these all constitute sort of mental issues for them because
Definitely, yeah.
because that is so. But it's a very sad situation. But it's the fact.
It is a fact.
It's the fact what's happening.
Yeah.
So we'll have to find solutions and then go ahead. And of course, there's room for improvement.
Yes.
And I also know there are few other organizations, private organizations, who are trying to assist people with I don't know about medically, but maybe some like maybe therapy or something like that. Yeah, but you made a very important point, is the way they can seek help in case of need. And if they don't have sufficient means, then they have certain organization who are willing to look into it, right?
And also QPAST as well works with people from trauma backgrounds as well. So it's a trauma specific organization working with people from refugee backgrounds.
Right.
Work with
Yeah,
trauma.
QPAST has been very active with refugees.
Yes.
So it is good that they have a what you call a sector that looks after the people. Yes. So Millie, thank you so much for stopping by. And I wish you, I know you need heap of energy, heap of energy going around different places. Though Gold Coast is a small place, but you have to travel a lot because it's like a banana, long stretch from here. But glad that we have people like Millie in our community. I met her several times. They have a seminar that they organize for community leaders, multicultural representatives. So they try to educate us. That's one good way of letting people know. But today with this show, we got to know much better about the whole thing about the mental issues. And is it convenient to put your contact details if they want to contact you? Or
yes, definitely. And I'll also put contact details of our MH call, which is ACT intake, which is the first point of contact for mental health. So if anyone is really worried about their loved ones or their mental health, the first point of contact, it's a 24-hour service number for and they can assess you over the phone. And if they feel that you need further assessment, they can refer you further within our organization. So I will also put the MH call details as well as my details as well.
That's very important. That's very important because people are not very familiar with this. Suddenly they see their loved ones going through these mental issues, so they want a number where can they contact. So good. So we'll put this information below the videos. So if any family members are concerned about their members in their family, so they can contact that number, which is 24 hours. And then from there you can follow up further. All right?
Yes. Okay. And just to finish off, I just wanted to say it's okay not to be okay, and people shouldn't be afraid to talk about, their emotional well-being, because there's help out there.
This is one point. What you mentioned was correct. You have to reiterate this, because when people have this problem, they keep it to themselves. All right? But it's very important they discuss. They talk about it. And more conversation. That's very important. Somebody told me it's very, very important. Even with they have been diagnosed with this, but still it's very important to have communication with friends. Keep them busy with communication rather than putting they on their own, suffering on their own. Right? So that's where the families play a big part. The friends play a part. Also the community. The whole family. And so that's good. So Millie, thank you so much.
Thank you so much.
Before you go, I would like to appreciate the services that you do. for the community, especially the multicultural community. So I would like to present you with a small token of appreciation. So Millie, thank you so much.
Thank you so much.
Thank you. So I just want to read it out. Award of appreciation presented to Millicent Magada for appearing on Baba's talk show and for your services to the community. Thank you so much. Millie, thank you so much for your services to the community, especially the multicultural communities. You know, these are very, very important issues, and I'm sure you're handling it well. I wish you all the best. And before you leave also, I just want to mention our motto. No matter where you come from, no matter what language you speak, no matter what your religious beliefs are, we are all brothers and sisters in humanity. Therefore, we should respect each other, extend love and care, and be compassionate to one another. So you're one of those people.
Oh, thank you.
Yeah, because you work with multicultural. You do, I know it's your job, but again, personal also, you know, because you deal with different cultural background, different religious background. So sometimes you have to be very sensitive. So how you be sensitive is by respecting their culture.
Yes.
And be understanding and compassionate.
Yes.
All right, Millie. See you next time. All the best.
Thank you very much,
Okay.
Hussein.
Thank you.
Thank you.
Okay, audience, thank you for watching. I hope you got quite a bit of information about mental health. And if you want to know more, the contact details are below this video. Okay, we'll see you next time. Assalamu alaikum.